Autumn, and she came to us last month. She had some a bulging disc issue causing some sciatica down her left leg, and she had some tears in her lateral meniscus in the left leg, and they wanted to do some arthroscopic surgery and some epidurals in her back. Instead, she came to us, and we decided to try the laser stem cell signaling for the lumbar, sciatic, and knee issues. So Autumn, if you could chime in, just like you talked about the sciatica. How's the sciatica now 1 month later?
I haven't had it flare up on me at all since I got the injection, which I'm really happy with that for sure. Even movements that would trigger it before,
Yeah.
when I do them now, no problem.
Could you demonstrate what movements used to bother sciatica?
Anything that required any type of twisting.
I see.
Yeah, so but normally I'd be having pain at this moment, but yeah, when I would go for walks, that would trigger it too. But with the light walking I've been doing, it hasn't been triggered.
Great.
At all. Yeah.
And how long have you had that sciatica before we knocked it out?
Oh, it started, I think I told you guys like 6 or 8 months ago.
Oh wow, okay.
Yeah.
It's only been a month and we kind of knocked it out.
Yeah, that I'm really happy about.
All right. And then what's going on with the lateral knee?
It is better. Again, back to the movements.
Okay.
So,
what used to bother at the knee? What movements? Twisting?
So any type of twisting. So
okay.
Or if I go we used to go like this, lift it up backwards.
But now you can do it.
Yeah, I can. And I was surprised, I wasn't paying attention to what I was doing when I did this lateral twist out of the car, because normally I wouldn't do that. I would
but now you can do it without being careful.
I caught myself oh, that didn't even hurt. So from that perspective, movements that used to trigger the pain are not triggering the pain.
Exactly.
So that's a positive. I mean,
and it's only been a month since we did it. So how many percent improvement, if you had to put a number for the sciatica, lumbar, and knee? Would you put?
I'm going to say 60% only because I'm not being active beyond light activity.
Exactly.
So it's hard for me to judge.
That's the golden test if you get back to activities you love.
Right.
Was that more definitely softball, tennis, hiking? Yeah, I think when you could take 5,000 to 10,000 steps without pain, you'll be ready to slowly get back.
Right.
Because all those activities, you have to plant and twist your knee, and for the sciatica, but it's obviously encouraging you. At least you could do it with light walking activity, then slowly we'll ease back in that. Okay, so maybe in a couple months I'll give you the green light to go ahead and go back real slowly. Tennis, maybe doubles, maybe I want you to try pickleball. At least you get some court. It's not as strenuous, but it is what it is.
Yes.
But yeah, like I said, I estimate about 10% improvement a month, already 60%. You're getting 6 times warp speed, improvements, which I like. Today, since you're here, we're going to give you a little shockwave and laser therapy to keep the cells stimulated. We'll have it back in a couple months, okay? Well, congratulations.
Thank you.
All right.